Okay, let's go through the physiological effects, indications, contraindications, precautions, all that kind of good stuff. So here's our little kind of flow chart for our physiological effects. Um, so when we apply laser energy to the skin, photons get absorbed by those photoreceptors or the chromospheres. For the most part, what happens when those photons get absorbed is there's stimulation of the mitochondria. And we know mitochondria is our energy, our workhorse of the cells, right? So we're going to affect how the cells function in that manner. So there's a couple different ways and pathways that we get the results that we see. So we get a facilitatory response, meaning that this is going to help all of these things. So we increase ATP synthesis. Makes sense when we're stimulating the mitochondria. That's going to stimulate electron transport, which is going to increase cell metabolism, increase cell permeability, which also would increase phagocytosis. So when we think of the tissue response process, we see that increased phagocytosis, which is going to allow us to clean up a wound faster and more efficiently. With that increased ATP synthesis, we also have more energy to have more protein being synthesized. And we know protein is going to be really important for our repair. We get increased cell proliferation. We build new cells. We repair the cells. We get increased enzyme activity that's going to help again with some of the breakdown and the activity level of those cells. And so all that leads us to more tissue repair. We also get an inhibitory response. So we reduce the intracellular pH, which we know gets increased with injury. We also decrease COX production. So COX, for those of you that have not taken drug in sport yet, the COX is an enzyme, cyclooxygenase, is an enzyme that typically appears during the inflammatory process. And it is what creates some of our chemical mediators to our inflammatory process. So when we talk in drug and sport, we talk about how anti-inflammatories block the COX enzyme from helping to create these chemical mediators that are causing problems. So if through the light therapy we decrease that COX production, that results in less inflammation in the area, less of those chemical mediators being released or created, so less of the effects that inflammation has. And then the indirect effects that happen, so because of what's happening over here, we also get these things. We get some increased blood flow to the area. That also enhances lymph circulation. We also get more granulation tissue, scar tissue being laid down, so we get healing a little bit quicker. So those things affect inflammation as well. And the side effects of the inflammatory response phase. And then if we have more tissue repair and we reduce those chemical mediators that we know like to activate our pain response or nocioreceptors, we get decreased pain. So typically what we're using light therapy for is wound healing, especially in the cellular phase where we get increased mast cell release. During the repair phase, we get that enhanced collagen. If we're more in like the remodeling phase, we get more wound contraction and tensile strength of our wounds and our healing tissue. As far as pain relief goes, lots found with acute musculoskeletal trauma, myofascial pain, rheumatoid arthritis, carpal tunnel, low back pain, trigger points, neck pain, a lot of them muscular based. It's also, a couple studies have shown to increase serotonin release, which we know is part of our, especially the androgenous opioid level, so our level 3 pain relief there. That can have some decreased pain transmission. There's also some studies that claim placebo effect with it and getting pain relief through that. Other studies come back and say that there's no effect on musculoskeletal pain or lateral ankle sprains or plantar fascia or delayed onset muscle soreness. So that's what you're going to run into with trying to do evidence-based practice with the light therapy is there's very mixed results, and we'll see that when we go over our overview as well. So the FDA believes that more evidence is necessary for approving light therapy across the board. To date, light therapy has been cleared by the FDA for temporary relief of neck and shoulder pain of musculoskeletal origin, wrist and hand pain associated with carpal tunnel, and iliotibial band friction syndrome are the kind of three areas that the FDA has approved. So neck and shoulder pain of musculoskeletal origin, wrist and hand pain associated with carpal tunnel, and IT band friction syndrome. It's kind of arbitrary why those are the ones chosen. There's been more studies on those, so the FDA feels more comfortable with those. You can use light therapy for things outside of the FDA approval. There's a chance you wouldn't get reimbursed by insurance companies without that, though, or you would have to really show your evidence of why you're doing that. So pull the articles that maybe are newer, that are showing benefits. It's what's called kind of going off label. You can use light therapy for many other things based on the research that's coming out. But these are just the ones that the FDA has approved for. So there's liability for any damage if you would use it outside of those things, but you would just have to know why you're using it and how you're using it and have the evidence to back up your decisions. So let's go through those effects on the injury response process. So again, we get to depths up to about 2 centimeters below the skin surface. So that is not deep. You know, we're talking superficial, but it's those chemical reactions that then occur. So we call it photomechanical or photochemical reactions from the absorption of the photons. So it's not what we call photothermal, meaning that we're not producing any heat. These are called cold lasers for a reason. There's no heat involved. So it's strictly from the absorption of that photon, and it's not to levels high enough that we would get actual heat being produced. The first law of photobiology states that for light to affect tissue, it must be absorbed by specific receptors, and those receptors are typically called photoreceptors or chromospheres. So those include hemoglobin, the COX enzymes, so cyclooxygenase, myoglobin, flavoproteins, and melanin, like we talked about. So this therapeutic window, this chart from your book, shows that with the effect on the injury response cycle, we actually need to balance kind of our dosage based on the needs that we think we need potentially have. So we could inhibit fibroblasts if we have too much power, or we can stimulate fibroblasts if we're more on the low end of our power. And then somewhere in here, studies have also shown other anti-inflammatory effects. So for the most part, when we're in the early stages of our tissue healing, we want fibroblasts there, right, to be building tissue. So we'd want to be in these areas. Now, if we're getting scar tissue laid down that's inappropriate or other things, we might actually target something up here. So we just have to balance that within our dosages. So current evidence kind of suggests that we will get biophysical benefits related to the absorption of these photomechanical and photochemical results. So looking specifically at tissue repair, so the low-level light therapy, the LLT, can produce anti-inflammatory or pro-inflammatory responses. So that's what that diagram showed us before. So it's depending on your goal. In the range somewhere between 2.5 to 5 joules, an anti-inflammatory effect occurs and we stimulate fibroblasts. If we go up to 7 to 14 joules, we've seen more anti-inflammatory effects that continue, but actually fibroblast production becomes inhibited. So we'd want to make sure that we are balancing that based on where we think they are in the tissue. It can also be affected by the type of laser. Since we're talking about the amount of power the laser can produce, that could also affect which one we're trying to target. Usually when we're talking anti-inflammatory, we're talking about high red visible or infrared lasers. For wound healing, we're going to assist in healing of superficial wounds, including skin ulcerations, surgical incisions, burns. Those are the most common. We'll get accelerated phagocytic activities, so the cleaning up. So it actually, laser light therapy has been used as a bactericidal, so something to kill bacteria if there's a risk of infection. So specifically, helium neon lasers have been shown to be less effective at that than the gallium aluminum phosphate ones in one study. Absorption of the photon causes increased ATP synthesis, speeds up cell metabolism, encourages free radical release, which are part of, again, kind of the healing process. So we get altered cell metabolism, we get increased fibroblasts, lymphocyte, macrophage activity, we get increased circulation, we promote more granulation tissue and growth in the new capillaries. Again, if we're targeting that appropriately, we get increased fibroblasts. That's wavelength and tissue specific. And then we potentially get some increased collagen in those areas, which would potentially increase our tensile strength of those wounds. On our pain reduction, we look at the pain reduction happening due to altering the nerve conduction velocity. We also get decreased muscle spasms, so it's good for decreasing acute or chronic pain. It can alter the nerve conduction velocity, decrease the muscle spasms. One of the big ways they really think it is how we get most of our pain relief is that we decrease the prostaglandin synthesis. And those prostaglandins are going to be responsible for activating nociofibers. And so if we decrease those being created, goes with affecting the COX enzyme, okay, because the cyclooxygenase enzyme is going to help produce the prostaglandins. We get our decreased pain just because we have less irritating chemical mediators and prostaglandins in the area. The low intensity laser can also reduce the rate and velocity of nerve impulses if they're already inflamed. This is a big thing with the evidence in light therapy. Light does very little in healthy tissue. It has more effect when tissues are already altered or injured. So that's why some of the studies are hard, because we do a lot of our studies on healthy tissue, right? We look at putting ice bag on just normal ankle tissue, how deep does the cold go, or how low can we drop the temperature, what happens to blood flow, and we look at healthy tissue a lot of times because it's harder to recruit injured athletes. We'd have to wait for those, or injured patients. But with light therapy, that's really tricky because it doesn't appear to have many effects at all on healthy tissue, but it does have effects if you can actually target injured tissue. As far as fracture healing goes, we get increased capillary formation, calcium deposits, increased callus formation, reduction of the hematoma. All those are going to have potentially direct or indirect effects of the laser therapy that are working on that fracture healing. It seems really similar to the way the wounds heal with using light therapy, and actually possibly pretty similar to how our ultrasound bone growth stimulators, so when we talked about those, how those interact with the fracture healing. Longer wavelengths seem to be better, and they increase the density of the callus over the fracture more significantly than others. Most of these studies seem to be all animal study based, so that can be limiting and potentially inconclusive for us to look at, but more studies are coming out kind of all the time. So what are our indications? Whenever we want to kind of activate these cells into the healing mode, right? So again, that wound healing, if we want to increase mast cells, or if we're trying to enhance collagen formation, or potentially even enhance the wound contracture or the tensile strength, we really go into our wound healing pretty significantly. Our pain relief, mentioned these two, so our acute musculoskeletal trauma, myofascial pain, rheumatoid arthritis, carpal tunnel, low back pain, trigger points, neck pain. Again, we can potentially increase that serotonin. We would decrease our prostaglandins because we affect the cyclooxygenase enzyme. So we can increase potentially also the pain threshold and affect our nerve conduction velocity. So whenever we want wound healing, whenever we want pain relief, if we wanted to increase the tensile strength of the scar tissue, that would be another reason. Remember that we can use it for all these reasons up here. Research is mixed on some of these. Some of them haven't been studied as far as on very specific body parts or specific conditions. The FDA approval is for neck and shoulder pain of musculoskeletal origin, carpal tunnel pain for the wrist and the hand, and then iliotibial band friction syndrome. So those are the approved ones, but we can use it on other parts of the body if these are our goals. And we would then have to match our goals to it. We'd ideally find some evidence, or we're going on theory, and it's something that we try. So what are our contraindications? The biggest one is we do not want to irradiate into the eye, okay? That is dangerous. So again, we have usually safety goggles worn by both the patient, the clinician, ideally also covering the laser so that anyone who would walk by would potentially not be affected. If we don't have the special goggles, again, those aren't usually required for a level 3A. If you have a level 3B, then it is required, so it just kind of depends. But ideally, you always wear the safety goggles and you cover the laser. But otherwise, you can just cover the laser as well. You just would want to make sure that you don't turn on the laser until it's actually covered. We don't want to use it over the uterus during pregnancy, mainly because we don't know the effects. Cancers, okay, so it shouldn't be applied over tumors or cancerous lesions. Some studies have shown, and some of the long-term effects, that there's the slight risk of those patients who have had organ transplants, especially relatively recently, that the body rejects the organ transplant because of the light therapy. It was, again, handful of cases, that they've seen. So the efficacy of that, was there something else going on? We don't really know, but it's a warning, and we'd want to get approval from the physician, the surgeon, before we would ever apply light therapy. If there have really significant hemorrhages, we wouldn't want to use light therapy. Remember, light therapy will increase blood flow, so we wouldn't want to deal with that. So we wouldn't use the light therapy till later in the healing process, when the hemorrhage is controlled. If they have thyroid gland issues, especially wouldn't want to eradicate or radiate, over the thyroid. But even if they have thyroid conditions, we would want to check with their doctor, because we are accelerating the body in that healing mode and increasing ATP synthesis. And so for someone who is hyperthyroid, they're already overstimulated with growth hormone and things like that. And so we wouldn't want to keep increasing on that. There's some debate on whether it's safe over testicles or not. It does not heat, so in theory, it should be fine over testicles. But again, they just haven't done a lot of studies on that. Pregnancy, it goes with over the uterus during pregnancy. And again, anywhere in the low back or anything like that, we might want to watch. Other things, so some medications will increase the skin sensitivity to the light. We'll see those in our precautions. So we'd want to watch over for that as well too. So these precautions would be, let's check with the doctor. So if the person is photosensitive, so they have a condition where they're photosensitive, or if they're on photosensitive drugs, things like tetracycline, which is an antibiotic, oral contraceptive pills or birth control pills, certain ones of those can make you more photosensitive, antihistamines, as well as antidepressants. So we'd want to check with the doctor first, and if we do use it, we want to watch for actually what would look like a sunburn to kind of develop up to 48 hours after. So it would look and kind of feel like a typical sunburn, and that's a sign that they're photosensitive, and then we shouldn't do light therapy. If they have epilepsy, again, we usually cover the light. There's no real exposure eye-wise to the light, but sometimes that extra stimulation of light can set off an epileptic seizure. If they've recently had a steroid injection, the main reason is that a lot of the light therapy reasons that we'd use it are indications, and this goes also with the anti-inflammatory medications. The reasons we use it a lot of times is to help the healing process along. If you're doing a steroid injection or taking anti-inflammatory medications, you're just trying to stop the inflammatory process. And so they're just kind of counterintuitive to each other of why you would use those. And then finally, if they have an acute infection, so kind of like our cancers, we wouldn't want to stimulate the growth of the infection. However, light therapy, some of the lasers do have bactericidal, so antibacterial effects. So again, we just want to check with the doctor and see if this would be something that we'd actually want to use. And we would, if we have open wounds, we actually put an occlusive dressing over their top to do the laser therapy so that we're not putting our laser on someone's open wound, but you would put that occlusive dressing bandage over the top. Just some other uses for light therapy. These are not ones that we will use, but just so you know, light therapy can be used to treat certain types of depression, seasonal affective disorder specifically. Dermatologists will sometimes use UV light to treat some different infections, so impetigo, folliculitis, herpes simplex. So the first two are bacterial, so again, having that antibacterial effect. Herpes simplex being a virus, it can shorten the outbreak when someone has a herpes outbreak. So it destroys kind of the superficial infectious organism. There's other dermatological disorders that are used as well. There can be some bad side effects if the light, especially the UV light, is used incorrectly, right? UV light can lead to skin cancer and things like that. So again, that's not something that we potentially use it for.